Hello, and welcome to another live broadcast with MedStar Health. November is Lung Cancer Awareness Month, a month dedicated to increasing awareness of lung cancer, its risk factors, symptoms, and treatment options, as well as the importance of early detection. Lung cancer is the leading cause of death among both men and women in the United States. That's why we're here with three of our specialists, Dr. Duane Monteith, a thoracic surgeon, medical oncologist, Dr. Chen, and Dr. Stephen Ronson, a radiation oncologist, discussing the facts about lung cancer and ways to reduce your risk. So thank you for joining. Stick around. Give us a like, let us know you're watching, and share this broadcast with your friends. It's really important to spread awareness about lung cancer. And we recommend, if you have any questions, ask them in the comments below. So first, let's meet our experts. We'll start with Dr. Chen. Dr. Chen, would you like to introduce yourself?
Sure. So my name is Chen. I'm a medical oncologist, and I've worked here at MedStar Franklin Square now for the last 8 years. But I did grow up in the Bethesda, Maryland area, so this was kind of a homecoming for me. I treat all types of cancers, but over the last few years, I've developed a special interest in treating lung cancers.
All right, thank you so much. Let's meet Dr. Ronson next. Dr. Ronson?
Hi, my name is Steve Ronson. I'm a radiation oncologist. I've been in the MedStar system now for 14 years, and it's been great working with Dr. Chen, Dr. Monteith, all of our lung cancer experts. I think we do a great job here at taking care of lung cancer.
Great, thank you so much. And Dr. Monteith?
Hi, I'm Duane Monteith. I'm a thoracic surgeon with a specialty in thoracic surgical oncology, meaning treating lung cancer with surgery. I joined MedStar a couple of years ago, and it's been great. I have a great team to work with, including my fellow colleagues on this call.
All right, thank you so much for all of you for being here today to discuss this important topic. We're going to talk about risk factors first, and then we'll talk about screening, diagnosis, and treatment of lung cancer. Dr. Chen, I'm going to start with you. We're going to talk about risk factors, but before we do that, can you talk about whether or not lung cancer can be prevented?
Sure. So not every case of lung cancer can be prevented, but the vast majority, of course, are caused by cigarette smoking. So never picking up a cigarette will make a huge difference in reducing your risk. And if you are smoking, stopping smoking will also reduce the risk. So by far, that is the biggest change that you have control over, that if you stop smoking, you will certainly reduce your risk of lung cancer significantly.
All right, yep. Thank you very much. What about warning signs and symptoms? Can you talk about those of lung cancer?
Yeah, so some lung cancer will have no symptoms. Someone won't feel anything, and we can catch it maybe just on a screening scan. But as it progresses, it commonly would cause lung problems. So kind of what you would expect: shortness of breath, cough, sometimes coughing up blood, sometimes having repeated infections. And if the cancer does progress and get out of control, then you're talking about pain or weight loss, just severe fatigue. So it kind of depends, but it can present in many, many ways.
All right, thank you. Dr. Ronson, what are the biggest risk factors for lung cancer?
Like Dr. Chen mentioned, by far and away, the biggest risk factor for lung cancer is cigarette smoking. But there are some other risk factors that come into play. Radon exposure, which can sometimes be detected in people's basements, can sometimes cause lung cancer. There are some other environmental or hazardous exposures that can contribute to lung cancer, and some not very common types of lung cancer. People have heard of asbestos and how that's dangerous. So there's multiple different causes, but again, just to echo what Dr. Chen said, cigarette smoking causes the vast majority.
All right. Thank you so much. Dr. Monteith, question for you. How do you determine if someone is at high risk of developing lung cancer?
So, with cigarette smoking being the largest risk factor, we typically go by how much that person has smoked and for how long. So generally, it's a number called our pack year history, which is essentially if you smoke a pack a day for a year, then that's 1 pack year. If you smoke 2 packs a day for a year, that's 2 pack years. So that's one of the main ways we go about determining whether someone is high risk. Also, if you work in a high risk occupation where you are exposed to things like Dr. Ronson mentioned, radon, asbestos, other kind of hazardous chemicals, we would put you in the high risk category.
All right, thank you. So, Dr. Chen, if our viewers believe to be at high risk for lung cancer, what should they do?
You have to get screened. If you meet those criteria of having a high enough risk, then get screened. Just as we recommend mammograms and colonoscopies, lung cancer screening has moved up there as well because of how much it can improve your survival. So get screened.
Great. And let's talk about what that screening entails. Dr. Monteith, I'm going to shift over to you again. Can you talk about the screening guidelines and how someone would find out if they're eligible for a lung screening?
Sure. So this is actually a moving target because actually at the beginning of the month, the American Cancer Society released new guidelines in terms of who should be screened. So based on their recommendations, you have to be between the ages of 50 and 80. And you had to have had at least a 20-pack year history, meaning you've either smoked for a pack a day for 10 years or for 20 years, meaning or a pack a day for 20 years or 2 packs a day for 10 years. What has kind of changed recently is there used to be a requirement that you had to be a current smoker or smoked within the past 15 years. However, a lot of data has shown that any smoker, whether it's been 20 years, 30 years since you smoked, if you're in that age group and you've smoked over a 20-pack year, or you have over a 20-pack year history, that you should get screened. So the best way to kind of find out is there are a lot of resources online. And if you go to our MedStar Health webpage for lung cancer screening, it will have a lot of useful information on how to get screened.
Thank you very much. And we will post a link to our health risk assessment, which includes eligibility for lung cancer screening. So you can take that as well. So let's talk about diagnosis now. So you are at high risk, you get screened, and then the next step would be a diagnosis. Dr. Monteith, how is lung cancer diagnosed?
So generally, we will see lung cancers will typically show up as a lung nodule on a CAT scan or sometimes even on a chest X-ray. From there, generally to get the diagnosis of lung cancer would require a form of biopsy. And there are several ways of biopsying. At MedStar, we have all the latest minimally invasive techniques in terms for biopsy, including using a CAT scan machine to guide a needle into the nodule to get the biopsy, or a what we call robotic bronchoscopy, which is an advancement in diagnosis where bronchoscopy is pretty much like a colonoscopy for the lungs. However, the robotic part allows us to find smaller nodules and nodules that are further out in the lung. So those are the mainstays of diagnosis in terms of lung cancer.
All right, thank you very much. Dr. Chen, what are the different stages of lung cancer? So you're diagnosed, do you determine what stage a patient would be at, and what stages are there?
Right. So like most cancers, we stage lung cancer stages 1 through 4, where 1 will be your earliest and 4 will be your most advanced. Typically, stage 1 lung cancers are just a small little tumor in the lung by itself. Stage 2 is typically when it's a little bit bigger, or maybe it's starting to spread a little bit to the lymph nodes in the periphery of your chest. Stage 3 is when you're having multiple nodules on one side of your lung, or it's getting larger, or now invading the center of your chest, or invading up into the lower neck area. And then stage 4 is when you've lost some control and the cancer is starting to spreading to another part of your body, the other lung, to the brain, to the liver, or to the fluid around your lung. So we use all the tools we got, all the imaging scans, CAT scans. We have scans called PET scans, MRIs. So we use all that information to try to make our best judgment of what someone's stage is.
All right, thank you very much. And Dr. Ronson, are there different types of lung cancer?
Yeah, that's a great question. So lung cancer in general is split into two categories. We split them into small cell lung cancer and non-small cell lung cancer. And then within the non-small cell lung cancer category, there's multiple subtypes. There's adenocarcinoma, squamous cell carcinoma. Those are the two most common, but then there are some additional less common ones like large cell and things of that nature. But for the patients logging in today, I would say the most important thing to know is that our treatment recommendations are primarily determined by differentiating between small cell and non-small cell.
All right, thank you very much. Appreciate all the information about screening and diagnosis. Want to pause for a moment just to thank our viewers again for watching. If you're just tuning in, we are talking about lung cancer, as November is Lung Cancer Awareness Month, and that's a month dedicated to increasing awareness of lung cancer, risk factors, symptoms, and treatment options, as well as the importance of early detection. So very important topic that we are discussing today. If you haven't already, give us a like, share this broadcast with your friends and family, especially those that could be at risk for lung cancer, because lung cancer is the leading cause of death among both men and women in the United States. So it's important to spread the word about all of the discussion topics that we have today. We're here with Dr. Monteith, thoracic surgeon, medical oncologist, Dr. Chen, and Dr. Ronson, radiation oncologist. And we've been talking about so far risk factors, screening and diagnosis. We're going to shift gears and talk about treatment options. If you have any questions that we haven't answered yet, please ask them in the comments and we will ask those as well. So let's talk about treatment. We have someone who is at risk for lung cancer. We talked about smoking being the highest risk factor. Knowing that patients who are at risk for lung cancer, they should go get screened. We talk about the screening guidelines. We've talked about the tool that we have to see if you're eligible for a lung screening, and then you go into diagnosis, the different stages and types of lung cancer that you could possibly have. So a patient is now at the point where they've been diagnosed. Let's talk about treatment. I'm going to start with you, Dr. Monteith. How is lung cancer treated?
Sure. So, like Dr. Ronson mentioned, the treatment is going to be based on the type of cancer, with non-small cell being the most common type of cancer, lung cancer accounting for about approximately 80% of lung cancer is diagnosed. I'm going to kind of mainly cover that. Within that realm of non-small cell lung cancers, there's really now 4 mainstays of treatment. There's chemotherapy, there's immunotherapy, there's surgery, and there's radiation therapy. So my colleagues will kind of go into the, their specific areas of specialty. And I'll kind of more talk about the surgery part. Again, but one of the other things that kind of determines what treatment you may get is going to be based on your stage. So staging, again, like Dr. Chen mentioned, is really on a scale of 1 to 4, 1 being kind of earlier stage lung cancers and 4 being kind of advanced stage metastatic lung cancers. So again, the treatments are kind of by stage. And the way we kind of figure this out is we have what's called a multidisciplinary tumor board, where every week we all get together and we, number one, discuss the stage and discuss what are going to be the best treatments. And, I think that overall is, one of the best ways to kind of approach cancer, because it's a team effort. No one person or one specialty knows the best way. So it's always good to have the input of my colleagues in terms of what kind of treatments. And as we're seeing a lot more recently, there's typically going to be a combination of treatments, whether it's chemotherapy and surgery, or radiation and chemotherapy, or all all together. But again, that's mainly based on stage. So for early stage lung cancers, generally surgery is going to be the one of the kind of frontline treatments. Generally, once the cancer has spread outside of the lung, surgery is no longer an option. The mainstay of treatment for surgical treatment for lung cancer is actually removing the cancer. And in that process, we also remove lymph nodes in the area, which are going to kind of determine what additional treatment, if any, you may need after surgery. So to kind of go a little bit into the surgery, here at MedStar, we do the latest minimally invasive type of surgery, robotic surgery, or what's called a robotic lobectomy or segmentectomy. And a lot of people are confused about robotic surgery. It's not a robot doing the surgery. It's just another surgical tool that allows the surgeons, better visualization of the anatomy. It allows us to do a better dissection. It allows us to do a better cancer surgery. And for our patients, it means a quicker return to normal function, and typically less postoperative pain, and a shorter stay in the hospital. The way we do our robotic surgery is typically through 3 small incisions, about half an inch each, on your side. And we go in with the robot, and we find the cancer, we take it out, and as I mentioned, we take out the lymph nodes. It's a very safe surgery, and it's a very effective treatment for early stage lung cancers. There are some risks for surgery, and part of evaluating whether someone is a candidate for surgery is also to assess whether their lungs and whether their heart are in good enough condition to tolerate surgery. We were very efficient in terms of getting that done, and we can give you a good idea of whether or not surgery is going to be the right option. Because generally, if you have significant underlying lung disease, you may not be able to tolerate having part of your lung taken out. Or if you have a bad heart, then we don't want to risk you having a heart attack on the operating room table to treat your lung cancer. So we're very, very cautious about making sure that you would be able to tolerate the surgery before we go down that path.
Right, that makes sense. Thank you. So you mentioned surgery could be part of your treatment along with chemotherapy and others. So is surgery a standard part of treatment, or is it only for use cases like you mentioned where you're a candidate for surgery because you have the risk factors that you mentioned before with your heart that is less of a concern? So surgery is an option for you.
Sure. So surgery is an option for a lot of people. So anywhere, pretty much almost every stage from stage 1 through stage 3A, you would be a candidate for surgery. It's typically the earliest stage of lung cancer, stage 1A, where it's pretty much surgery alone. Generally, if you're in the stage 1B to 3A staging, there's going to be some combination of chemotherapy and immunotherapy in that in your treatment plan. And then, as we kind of advance also within the stage 3A, sometimes there's a benefit to doing chemotherapy, radiation, and then followed by surgery. So a lot of people, regardless of stage, are candidates for lung cancer surgery.
Okay, thank you very much. What about side effects? Are there side effects from surgical treatment?
Sure. So I get that question a lot. I can tell you, unfortunately, like any other surgery, there's some level of pain involved. Generally, the pain is typically managed with over-the-counter medications, and in rare cases, sometimes narcotic pain medications. That's generally only temporary. The overwhelming majority of our patients make a full recovery, and some of the one of the biggest concerns is, well, if you take out part of my lung, how am I going to be breathing? And that again goes into part of our preoperative workup of whether you're going to be a surgical candidate or not. If your lung function tests are adequate, then that generally predicts that you should not have any issues with breathing after surgery.
All right. Thank you so much for explaining that. Dr. Chen, from a medical oncologist standpoint, how do you treat lung cancer?
So we do a lot of things for our cancer patients, in the medical oncology world. Sometimes we think of ourselves as kind of the primary care doctor once you have a cancer diagnosis. We coordinate a lot of care. But in general, in terms of treating the cancer itself, we give drugs. And when people think about drugs and cancer, they're usually thinking of chemotherapy. And that is true. Chemotherapy drugs are still a big mainstay of our treatment for most cancers and lung cancers. However, there are newer treatments or different treatments out there now that we also prescribe, not just chemotherapy. So Dr. Monteith mentioned immunotherapy. That is a big thing that's going on right now in many cancers. And there's also pills. There are some lung cancers that have a specific mutation where you don't need chemotherapy, you don't need immunotherapy. All you need is a pill to take if you have a specific mutation that we find in your cancer. So that's kind of our role as a medical oncologist, is we work with our colleagues in the radiation world and the surgeons and to coordinate the care, and we coordinate the drug treatments when it's appropriate. And also we follow patients after, after the cancer treatment's done, we need to keep following to make sure that, they're remain cancer free and remission. So we keep following them just kind of like as a primary care doctor would.
Okay, thank you. You mentioned immunotherapy. I've heard of that as well. And I heard it can be effective in treating some forms of lung cancer. Is that true? You mentioned it, so I think yes. And is it widely available?
I mean, I would say immunotherapy has been one of the biggest breakthroughs in oncology in the last 10, 20 years. It is where we harness our own immune system to fight the cancer. And so it can be effective in killing the cancer using your immune system, and it seems to have longer lasting effects. Where for many years chemotherapy works, it kills cancer, but it doesn't last. The cancer finds a way to grow back, get smart again. Whereas if we can reprogram our own body's immune system, then that's a more natural way of killing the cancer. Not only that, but it can be oftentimes less toxic. It doesn't cause those chemotherapy side effects that everyone's afraid of. It doesn't cause low blood counts that leads to infections, doesn't cause hair loss. You don't get that nausea, vomiting that you get with chemotherapy. So it can be a win-win, killing cancer, keeping cancer under control, and not having the same side effects that you would with chemotherapy. And yes, these immunotherapy treatments are widely available now. They're everywhere, and they're on TV commercials. I'm sure my patients have seen drugs for like Keytruda, Opdivo. These drugs are being advertised on TV and all the time, and I think for good reason. Because they have significantly changed things for many people. Where 10 years ago, stage 4 lung cancers, it was almost a death sentence. Nowadays, we have our patients living 5, 10 years with stage 4 lung cancer because these treatments are now available. And we're using them everywhere. They're being used in stage 4 lung cancer, stage 3, stage 2s. We're giving it before surgery. We're giving it after surgery. We're giving it with radiation. We're just trying to find anywhere we can use it just because of how big of a difference it can make. And we're kind of still in the early stages of it, but I think it's going to be it will be the future.
That is wonderful news. Glad to hear that there's hope for our lung cancer patients with all of these treatment options that are available. So you mentioned immunotherapy being new as of the last 10, 20 years, I think you said. Are there any other new treatments that are available, and especially what are you most excited about that's out there now for treating lung cancer?
Yes, I mean, there's been breakthroughs all over the place. I mentioned pills. So that's what we call personalized cancer medicine, where we know that every person with cancer, their cancer is different from someone else's. And so we want to analyze everyone's tumor to the smallest molecular level. And here at Franklin Square MedStar, we reflexively send tumors for this mutation testing. We send it out and they run your tumor against a long list of mutations that are pertinent. And if there's a specific mutation that pops out, there may be a pill that will be very effective in killing that cancer. And so, just recently, another pill has come out for another mutation. So, it started off as one pill maybe 20 years ago. Now we're up to 10, 20, every day there's a new pill coming out that may be appropriate for that person. So that's something I'm very excited about, personalized cancer medicine. And of course, I'm also still excited about the immunotherapy, in which we're still finding new ways of harnessing it. Is it taking someone's own T cells and reprogramming it to kill cancer? So, there's been a lot of progress already made, but there's still a long way to go. And, we're going there.
That's very exciting. Thank you so much. Dr. Ronson, we talked a little bit about radiation oncology. Can you talk about the role of radiation oncology in treating lung cancer?
Yeah, so similar to what Dr. Monteith was saying about surgery, radiation can play a very different role depending on the stage of the cancer. So there are certain patients who are diagnosed with a very early stage cancer, and they might have the option of surgery if they're not a surgical candidate. We have radiation that can treat their lung cancer with very high control rates, high cure rates, and they might only need radiation alone and no additional treatments. For the higher stages of lung cancer, stages 2 and 3, we will use radiation therapy in conjunction with chemotherapy and afterwards some immunotherapy if a patient's not a candidate for surgery. Like Dr. Chen and Dr. Monteith mentioned, for certain stage 3 lung cancer patients, we will sometimes do a course of chemotherapy and radiation therapy before they move on to surgery. And then radiation therapy does also play a role in stage 4 lung cancer. If a patient is symptomatic from a certain site of disease in their body, radiation can be used locally to that one location to help alleviate any symptoms that they might be having.
Thank you very much. Let's dive into radiation therapy that's available. Can you talk about the different types that are available for lung cancer patients?
Sure. So the two main types that I would probably want to split radiation into, the first being external beam radiation therapy that we most often use when we're treating stage 2, stage 3 patients. And we also will use it in our stage 4 patients. That treatment normally involves a daily treatment, Monday through Friday. Those treatments can be anywhere from 2 weeks all the way up to 7 weeks of daily Monday through Friday treatments. The visits in our clinic are quick. Patients are usually only there for a half an hour, 40 minutes at most. It's like coming in and having an x-ray done each day. The other type of treatment that we have available, which we're very excited about, we work with Dr. Monteith with these patients, is our CyberKnife. So that delivers a type of treatment called stereotactic body radiotherapy. We most often use that for our early stage lung cancer patients who aren't candidates to undergo a lobectomy. And it's been shown to have quite high local control rates. It's completely non-invasive. For our CyberKnife patients, their treatment usually involves between 3 to 5 treatments total. They'll come in every other day. The visits are a little bit longer. Maybe you're in our CyberKnife suite for an hour. And patients do quite well with the treatment.
Thank you very much. How long does the course of radiation therapy usually last?
So it can be, like I said, from a CyberKnife course of treatment starting at 3 fractions. They could get their entire course of treatment and be in remission in less than a week, all the way to they might need 7 weeks, 35 treatments of daily radiation with chemotherapy. Then they might either go on to receive immunotherapy or they might move on to surgery. So that whole treatment process could be stretched out over the course of several months.
Okay, thank you very much. And what about side effects? Are there any side effects from treatment?
Yeah, so side effects from radiation therapy, the one side effect from radiation that is systemic is fatigue. So patients sometimes feel a little bit tired during treatment. That usually sets in a week or two into their course of treatment. The other side effects from treatment are localized to where we're radiating patients. So if I'm radiating a lung cancer patient and I'm treating their thorax, their list of side effects is going to be very different compared to if I'm treating someone's abdomen or their brain. But when we treat the thorax, the radiation can cause some swelling and inflammation. So locally, and once you understand that, the side effects kind of make sense. The radiation can irritate some of the normal lung around our target, which can cause a dry cough. Your esophagus passes down through your chest as it's heading to your stomach. If that gets irritated, it can hurt to swallow or feel like food's getting caught. The normal organs in your chest, we know the tolerance of all those organs to radiation. So your heart, your lungs, your esophagus, your spinal cord, our treatment planning process is designed to make sure that the treatments we deliver are what we consider extremely safe.
All right, thank you very much. I'm going to shift gears back to Dr. Chen. Want to ask you about clinical trials. Are there any clinical trials available for our patients?
Absolutely. Clinical trials is so important in the oncology world. That's how we make progress. That's how we get better and get better results, and patients do better and live better. So yes, there are many trials out there. I would say any major cancer center in the country will have clinical trials. We have our own different trials. Here in MedStar, we work with Georgetown, the Lombardi Cancer Center down at Georgetown. We collaborate with them. So we open trials here and share them with them, and they open trials there that we might open here. And it's always moving, meaning trials open and close all the time. And trials are open for specific situations. Some are going to be for a person first-line treatment for stage 4 cancer or second-line treatment. But there's also trials looking at, should we be giving this drug before surgery, or should we be giving this after surgery, for earlier stage lung cancer? So, there's different trials out there, and it all depends on, what stage of cancer you have, what type of lung cancer you have, and to see if you're eligible, how healthy you are, what other medical problems you have. But I think that's one of the most important things is any patient with cancer, we need to consider, is there a trial open, available that they're eligible for? And if they are, we have a research team here that will screen you immediately. As soon as they know about any cancer patient, they'll screen you automatically. So even before meeting you, we'll know, is there a potential trial that you might be eligible for? And if you are, we will definitely tell you about it. And these trials, of course, are purely, optional. Some patients are very interested in studies. Some might not be. They may not be as comfortable trying newer, more experimental treatments. But I do think that these trials are so important, and it is one of our priorities to keep opening and screening patients and getting as many involved as possible.
That's great. So yeah, the role of all of the different players in identifying what the best course of action is for each individual patient, depending on the stage, depending on everything that was discussed in the tumor board that you mentioned earlier, including the clinical trial opportunities. Sounds like there's a lot of different options. And as a lung cancer patient, there is hope, and there are different ways of treating your lung cancer, and maybe a clinical trial that you could participate in that can help you with your treatment, your course of action. So thank you very much for talking through that. I think that's an important point as well, because it doesn't just stop at what we've talked about so far in the treatment options. There's these clinical trials that are out there as well, that are constantly becoming more and more available. Okay, so we've talked a lot about the process. So you have the risk factors, you've been screened, you have a diagnosis, and we've talked a lot about the treatment options. So before we close out, want to talk through what we offer here at MedStar Health. Dr. Monteith, I'm going to turn to you. A patient is at that, at different stages. They could be at any stage, really. Why should they choose MedStar Health for their lung cancer treatment?
Sure. So there are actually several reasons. One of the reasons we touched on before that, we really take this kind of team-based approach. We all get together every week, all the different specialties, the radiologists, the lung doctors, the lung surgeons, the medical oncologists, radiation oncologists, and we all get together and our research specialists too, can't neglect them. We get together and, kind of discuss your case before you're even seen in the office. So by the time you're in the office, your doctor already knows all your history. The other thing is, even outside of these weekly tumor board meetings, we have each other's cell phones. We call each other all the time, for second opinions, or for whether or if we have a difficult case. We're texting each other all the time. It's a very collaborative kind of team-based approach. But I think really the most important factor is timeliness of treatment. We can generally get you in within a week to any of the specialists, whether it's the surgeons, the medical oncologists, radiation oncologists, sometimes next day. And I'm not going to name names, but a lot of our regional competitors have given patients appointments months out. We generally can get the ball rolling within less than a week. I think that's very important in terms of cancer. As everyone knows, cancer, as time goes on, it grows and it can spread. So timely treatment is really one of the most important things. And then here at MedStar, we're kind of at the forefront of utilizing all the latest technology, whether it's robotic bronchoscopy, robotic surgery, robotic radiosurgery, the immunotherapy, the other targeted therapies. I think we're really kind of at the forefront of these kind of advancements in treatment. Lung cancer treatment, like Dr. Chen said, is changing every day. There are new medications. There are new protocols, and we're really good at staying at the forefront of these evolving treatments.
That's great. Thank you so much. So, Dr. Chen, if someone has been diagnosed with lung cancer, maybe they are seeing someone else, should they get a second opinion, perhaps from one of our specialists at MedStar Health?
I think so. I mean, I think there's a big role for second opinions, and for lots of reasons. I think that cancer treatments some of it is standardized, meaning there's a playbook that we all generally follow, but there's a lot of nuance there as well. And as Dr. Monteith said, some centers, will have newer technology, more expertise, and more of a multidisciplinary approach, which can make a huge difference. And then, of course, as we talked about as well, clinical trials. Some centers will have trials that are open only at their center. And so if it can be done in a timely manner and you feel comfortable with it, I do encourage patients to get a second opinion often, to make sure that you're getting the best possible care, because obviously this is a very important thing to undertake. This cancer journey is a very, very hard, difficult thing, and you have to be comfortable with the team you're working with and comfortable that you're getting the best care possible. If not, then then it could go very badly.
Thank you so much. Dr. Ronson, why do you feel patients should choose MedStar Health for their lung cancer treatment?
I think we have a great team. I think we work very well together. And like Dr. Monteith said, we get patients in and get the ball rolling quite quickly. So I think if patients are looking to to advance their workup, their staging, and get their treatment going quickly. Calling our team, we could sometimes have a patient see all three of us within one calendar week. And so just having that ability and having physicians like Dr. Chen and Dr. Monteith, who are so passionate about treating lung cancer and willing to come in early and stay late and squeeze patients in and get the treatment going, I think it makes a big difference.
Yep, that is great. Thank you so much. So that's all the questions that I have for you today about risk factors, screening, diagnosis, and treatment, and also why patients should choose MedStar Health and our clinical trials, second opinions. Before we wrap up, I do want to give each of you an opportunity to provide any last thoughts or key takeaways to those that are out there watching today's broadcast. Maybe they are personally affected by lung cancer, they've been diagnosed, or they have thoughts that they either have risk factors or they could have risk factors if they choose not to quit smoking, for example, or they have family members that they want to help support. As Lung Cancer Awareness Month continues, want to encourage them to share this information to make sure that we are all educated and we can make the best decisions for ourselves and our family. So what key takeaways do you want to make sure that our patients get out of today's broadcast? I'll start with you, Dr. Monteith, then I'll go to you, Dr. Chen, then Dr. Ronson. Dr. Monteith?
Sure. So, we, in this age of the internet, we certainly realize our patients' usually first consultant is Dr. Google. And when you Google lung cancer, the numbers are scary. However, you have to really kind of look at it at a more detailed level. The overall lung cancer survival rate is 18%, or somewhere between 15 to 20, depending on who you follow. However, that takes in all stages. If lung cancer is caught early, like through lung cancer screening under stage 1, your survival rate goes up to almost 85 to 90%. So that's a huge difference. So again, to kind of re-emphasize, get screened, because if we can catch it early, your survival is going to improve significantly.
Yeah, thank you very much. Dr. Chen, how about you?
Yeah, I agree with Dr. Monteith. I think number one, stop smoking. Everyone, please stop smoking. It's one of the worst things in the world. Please stop, and encourage your family members to stop. Seek out smoking cessation. The programs out there. Talk to your primary care doctor. There's so many options of ways to help. It's addictive. They hooked you, and it's very hard to stop. But there are ways to help. So please don't give up on that. Do get screened. If you are high risk, though. So again, talk to your primary care doctor or seek out a screening program out there like we have here at MedStar to get caught early. Like Dr. Monteith said, the prognosis is so much better if it's caught early. But also I want to offer hope to everybody else, those that have a little more advanced stage. We're making progress. For a long time we weren't, but we are now. And there are so many new treatments out there that we're all amazed by some of the results we're seeing, and it's getting better. So so please just keep seeking out treatment when you need it.
Thank you. That's very encouraging. And Dr. Ronson.
Yeah, we'd mentioned it earlier in the broadcast. Lung cancer is the leading cause of cancer death for both men and women. And like we said, like Dr. Chen just mentioned, smoking by far and away is the number one risk factor. So quitting smoking, know your risk factors, talk to your primary care provider about a screening lung CT, sign up for a screening lung CT if you check the boxes for those risk factors. It's such a dramatic difference. An early stage 1 lung cancer can have a 90+% chance of cure versus very low, even down to 0 chance of cure as the stages advance. And those lung cancer can go from stage 1 to stage 4 in sometimes months or less than a year. So just knowing your risk factors, having your screening lung CTs done, along with mammograms, along with colonoscopies, the other screening tests that people qualify for, it can make a huge difference in diagnosing patients earlier and our ability to provide them with a curative treatment.
Thank you very much. Really appreciate all the insights and knowledge that the three of you shared today. Thank you to our viewers for tuning in and watching. If you would like more information or to schedule an appointment, you can call 443-777-1133. We will post that number in the comments as well for you to easily access. Thank you so much to the three of you again for joining us today. Really appreciate all the work that you're doing for our patients and helping to educate and treat our patients. So thank you again and have a great rest of the day.
Thank you.